After helping to pass the health care reform bill last week, Congressman Peter DeFazio says he's proud of the new legislation. Today, the Oregon Democrat held a news conference to outline how the new law will help all Oregonians. KEZI 9 News reporter Lindsay Doy was there. She's now live in the newsroom to tell us more. Lindsay?
Well, Rick, a panel of local healthcare experts as well as local business owners joined Congressman DeFazio today as he discussed some key issues of the new bill.
People want access to good health care in this country. They deserve access to good health care in this country, and we aren't going to put up with technicalities anymore in depriving people of access to good health care.
Congressman Peter DeFazio championed the health care reform bill's effects on Oregonians Monday, though some local business owners like John Anderson remain critical.
This current legislation does not go anywhere near enough to controlling costs. We've heard everybody talk about who's covered. Well, somebody has to pay for that coverage.
He says the bill offers him no incentives to offer insurance to his employees. In fact, he says he'd save money by dropping their coverage altogether. But while Anderson says the bill needs some work, he's glad that there's at least a foundation in place.
I know they'll fix it. And that's why I think the bill was a good bill, because we've now set a baseline.
DeFazio says a major aspect of the bill is encouraging preventative health care and keeping us all healthier. Local doctors point out that many patients routinely skip doctor visits because of the cost, only seeing a doctor when a problem becomes severe.
A young man who didn't get a high fever treated, didn't have leg numbness treated, finally went, because he had no insurance, finally went to the physician when he was paralyzed in both his legs.
We definitely see patients coming into clinic seeking care for illness later, even for their young, small children, because they're trying to manage what they can at home and putting off what isn't absolutely necessary. And by this bill expanding preventive coverage, we will see less and less of that happening too.
And DeFazio also talked about the bill's benefits for seniors. He says many doctors currently can't afford to treat older patients due to low Medicare reimbursement rates. But with the bill's new adjusted rates, DeFazio expects seniors to finally get the care they need. Lindsay Doy, KEZI 9 News.